to protect yourself. We are protecting যে আমার ওই ডিজিজটা যাতে না হয়, তাই তাহলে immunization is a specific protection. It is a primary prevention. Primary prevention usually two types we can do: by health promotion, promoting your body by doing good lifestyles, good exercise, good food, balanced food, etc., etc., or promoting the environment, etc., etc. And specific protection is by specifically protecting from particular disease. So immunization specific protections, right? So before coming to the immunization, we have already discussed how disease occurs. I have already discussed you that usually previously ancient times it is said that disease is due to the, when science was not developed, disease is the curse of God. Due to curse, disease is there. Then when the scientific theory came, science started developing, then it is said that disease is due to the germ. It is called germ theory. The different types of germs are there in the environment. But afterwards, it has been found that in modern theory, the disease is due to the interaction of three factors: agent, host, and environment. Several times there are in the books, this triangle is there for agent, host, and environment. Agent means disease agents. So this is three types. So it is called epidemiological triad. That is, it is the how disease develops, how disease transmitted. That is can be described, can be explained by these three factors, agent factors, and it is proved nowadays. So epidemiological triad means human health and disease are the result of interplay between three types of factors: agent, host, and environment. Host means your body, your individual, host factors. Agent, there may be physical agent, chemical, all these things discussed, biological. Host, maybe you have some intrinsic factors. You have some power, body structure difference, your genetic difference is there, intrinsic factors. Demographic factors means sociological, demographic, epidemiological, cultural factors, psychosocial factors, etc. And environment may be again physical, biological, all these things. Environment means air, water, soil, and different types of environment. Even nowadays it is called the socio-political environment is also a type of environment. Okay, if sociological factors, if we remain poor, we cannot buy much more, so we can suffer from disease. For this reason, poor people suffer disease more because they are all these things. Okay, so this, suppose immunization, I have already told you, immunization to protect your individual from communicable disease. You know communicable diseases, which diseases caused by bacteria, virus, parasites, etc., etc., all these things. So how this chain of infection is there, how this infection occurs. So it is called that transmission of the disease we already discussed. Disease, some source is there, reservoir is there. A reservoir of source may be a human being, a reservoir source may be animal, a reservoir may be the inanimate objects, maybe the soil, maybe the water, maybe the food, reservoir of source of infection, and it enters your body, portal of exit. Reservoir, portal of exit, from reservoir it comes out, and it, through some modes of transmission, it enters through a portal of entry. Suppose he is the reservoir, he is suffering from respiratory disease. So when he transmit the disease, so some exit may be, he may be sneezing, coughing, talking, okay, and that through the transmitting agents, through air or other things, we will coming to that, other things it will infect you, your portal of entry. Portal of entry means he may, the disease agent may enter to him through mouth, through nose, through skin, through mucous membrane, right? And put to a susceptible host. That means you are susceptible. Susceptible host means, suppose you are there, he is there, or she is there. The same agent is going, but he is suffering or you are not suffering, because your intrinsic factors, your host factors may be susceptible. As we call it, the children and the old age, they are very much susceptible. They may suffer from disease. So this is called the chain of infection, right? Now this chain of infection I have already told you, from source to the particular susceptible host, it goes through some modalities of transmission. All these things are very simple and you have to know all these things. If one can understand it, then he can understand the clinics better and all those things better. He can diagnose it better and he can take appropriate measures for prevention and control of the disease. So modality of transmission may be direct transmission, direct may be person to person transmission. How person of transmission? If we remain in contact, we hug together, sleeping together, kissing, all these things, or sexual contact. This is person to person, right? Person to person contact, there may be disease may be transmitted. So it is a direct transmission. Or direct transmission may be inoculation of the agent directly from reservoir of infection. Inoculation of the agent, that means from the environment, the disease may enter on it. Examples, all of you know, but you cannot tell. If you walk barefooted through the fields and people are defecate openly, open defecation, so that if hookworm larva is there, that hookworm larva may enter through your sole and skin and all those things, it may enter. If your soil is contaminated with tetanus bacilli, for this reason we give any cuts and wounds are there, we give একটা tetanus নিয়ে নাও, একটা tetanus injection নিয়ে নাও. It is so important, like that. So often in the examination it is asked, can you name one or two soil-borne infection? So soil-borne infection means, example is hookworm larva, tetanus bacilli. There is another disease called leptospirosis. Leptospirosis, these germs are excreted by rats and rodents through their urine. It is called, it is the number one largest zoonotic disease in the world. Zoonotic means the diseases which are transmitted from animals to human beings. Those are called zoonotic diseases. Suppose rabies is a zoonotic disease, all etc. all those things. So that means inoculation of the agent. Agent means hookworm larva. Agent means tetanus bacilli. Agent means leptospirosis germs that enter directly from reservoir emission. Reservoir may be soil, etc. I mean stool and all those things. Contact of skin or mucous membrane with the agent contaminating in environment, same thing. Or inoculation of the agent may be you are giving unsafe blood in invasion through injections, etc., etc. Vertical transmission, it is called from mother. If disease transmitted through the fetus, it is called vertical transmission. Plenty of diseases, though placental, some barrier is there, but plenty of diseases enters through the fetus, right? So there is called vertical transmission. So these are the examples of methods of direct transmission. Again, there are indirect modes of transmission. Indirect modes of transmission means vehicle-borne transmission. Vehicle means the disease may enter through your body, through foods, through water, like all these things may be different types of vehicles up there, vehicles of transmission. Through, though air we are kept it separately, air is also a vehicle. Fomites. What is called fomites? Do you have an idea of fomites? These are fomites. Linen, handkerchiefs, your bed sheets, this desktop, door handles, knobs, these are called fomites. Inanimate objects. So these, if inanimate objects are already infected, through it you can transmit infection. For this reason, we call it wash your hands. Always wash your hands before food or all these things. During COVID, we always used to call wash your hands because you are traveling, you giving your hands touch different inanimate objects. That inanimate objects may contain bacteria, virus, parasites, etc. Through that, your hand and all those things, or your mucous membrane or skin, this may enter. So these are called fomites. Your fingers, these also mode of transmission, very, very common. Human beings, always say very, very common. And actually, frankly speaking, we always used to say the Western people, they are very much, I mean, always a bit ahead of us. So they started that taking food by these spoons and etc. Of course, spoons must be 100% sterile. because it is not possible. Hands and fingers are always contaminated. Your hands is there, everything is contaminated, plus or minus. Okay. Air, through air transmission may be there indirectly. It is called maybe droplet infection. Droplet infection, plenty of examples are there, respiratory diseases or coverts. There is two terms called droplet infection and droplet nuclei. Actually, it is same. Droplet infection is almost same. Droplet infection is a person is very side by side within 1 meter distance. So due to your talking, sneezing, coughing, the disease enter directly to that inhaled or through mouth inhaled by other individual. This is droplet infection. Droplet nuclei means actually the disease agents, bacteria, virus, parasites, in the dust they are contaminated. Nuclei is there. So a bit of heat resistance is there. They can survive in the that dust for a long time. So they, travel through the air currents, maybe far away, maybe 10 meter, 15 meter, 200 meter, or maybe 1 kilometer away. They may infect the individuals. So droplet and droplet. For this reason, we call it is better if you always use your mask. Even not during COVID, if you use your mask through traveling, all these things, you can prevent, you can protect yourself from different diseases, especially respiratory borne diseases. Not 100%, but most of the these common surgical masks, they can prevent at least 80 to 90% infective agents, etc. Right? Vector-borne transmission. What is vector? Example of vector? আগে মাইটস বললে, আগে কমনটা বললে না? রাইটস? মস্কুইটো বলো না। এই পৃথিবীটা সুন্দর হতো যদি পৃথিবীতে একটা অ্যানিমেল অর হিউম্যান না থাকতো, মস্কুইটো। মস্কুইটো তো নুইসেন্স, তাই না? পৃথিবীটা সুন্দর নয় কারণ মস্কুইটো আছে, তাই তো মস্কুইটো ইজ নাম্বার। অল ইনসেক্টস, থ্রু ইনসেক্টস মাইটস, দিজ আর সেপারেট। এগুলো পড়ানো হয় বা না হবে, নিজেরা পড়ে নেবে এগুলো। অল দিস থিংস, insects, mites, all these things, these are bits of. So these insects, mites, and all those things, through these, a person suffering from malaria or dengue or yellow fever or other things bited by mosquito, and in the mosquito or in the insects, there are some developmental cycle is there. Some multiplication occurs, some development occurs, larva, then other things are there, then they bite other healthy individuals, then disease is transmitted. So this is called vector-borne disease. Vector-borne disease is a chapter in the books. Vectors. So who are the vectors? Vectors means this. It is called usually invertebrate animals. Usually not vertebrates we call invertebrates. Suppose insects, etc. যাদের স্পাইনাল কর্ড নেই, মানে মেরুদণ্ড নেই, not vertebrate animals in a vertebrate animals or etc. So these are the called modalities of transmission, right? So one thing is there, this so we discussed that disease is due to agent, host and environment, right? And disease transmitted through agent to host through different direct transmission or indirect transmission. So how can you protect one individual? Immunization is one thing. You can protect your individual maybe by three factors. You control your host, control the source or reservoir. So agent may be controlled. Agent may be controlled at the source level, at the reservoir level. You are a reservoir. You are already some of the reservoir called carrier called. There may be animal reservoir. There may be human reservoir. Source is there. Okay. So that how can you control or protect others or protect the environment from these infection? How? Control the source. Common sense. You can do early detection of the cases, early diagnosis, Early diagnosis and treatment. Someone is short, someone is suffering. You can early okay. You can early diagnosis and treatment. Someone told secondary prevention. Secondary prevention is early diagnosis is treatment. So you can do early diagnosis and treatment. So you have another thing, you can protect the others individual from isolation or quarantine. What is isolation? What is quarantine? Is there any difference? Quarantine, do you what the name quarantine? Quarantine what টা শুনেছো? হ্যাঁ? Examples কোথায় quarantine করে? COVID এ করেছে। তো quarantine and isolation with the difference কি? Isolation you can tell daily isolation also. You are suffering from disease in your family, so that the family members cannot suffer or your roommates cannot suffer. I can isolate you. You are suffering from influenza. So I know usually influenza virus usually 7 days it is cleared up. Okay. So I can isolate you for 7 days, maybe in the separate room and all those things. You are suffering from malaria, so that mosquito cannot bite you, I can isolate you, I can keep you in the mosquito net, moshari. That is called isolation. That means people already, I know, diagnosed case when we are isolating the individual, it is called isolation. And quarantine means, quarantine is a type of isolation. It is called presumptive isolation. That means apparently he is suffering from healthy individual. People are coming from other countries. I know in the airport or in the railway station diagnosed someone suffering from COVID. So I am keeping those individuals separately in a hotel or other things for a few days. I know HIV incubation period. That is quarantine. Have you heard of the disease yellow fever? Huh? Yellow fever আমাদের দেশে আছে? আমাদের দেশে নেই। কেন নেই? You are right, নেই, হ্যাঁ? Vector নয়, vector তো mosquito. Agent নেই. Yellow fever virus is not there, but vector is mostly common. Yellow fever transmitted by which vector? Common. যেটা ডেঙ্গু ছড়ায়। Aedes mosquito. Aedes mosquito is plenty in our country. এই ঘরের মধ্যে Aedes mosquitoes are there. But as virus is not there, yellow fever is very much prevalent in African countries. So if you go to the African countries, we will not give you visa if you don't take yellow fever vaccine. So yellow fever vaccine is available at the airports. Yellow fever vaccine is available in All India Institute of Hygiene and Public Health, where I worked. I retired them as a director from there. Yellow fever vaccination is available at the ports. You are going. Okay. So someone is coming from African countries and entering in India, and I will see whether he has got actual vaccination certificate is there. If actual vaccination certificate is not there, I will quarantine him. I will keep him individually. I will not let him go to the society, to the community. I will keep him isolated for the incubation period of the yellow fever. That is called quarantine. So quarantine and isolation almost same. Isolation is where, I mean, separating the individual in a diagnosed case, and quarantine separating the individual or keeping them isolation in a apparently healthy individual. The people coming from African countries apparently healthy. People coming from COVID prevalent areas apparently healthy. So if I don't know, I can keeping them isolating. That is quarantine, right? So control of the source and all those things. You can control the animal reservoir, animal through veterinary system. You take that our pets and animals remain healthy. You take their preventive and control and treatment measures. So this is one factor, control the source. Second is you can do in the channels of transmission. Channels of transmission, you have some actions. So channels of transmission, what actions you can take? Common sense. Channels of transmission, I have already told you, yes, yeah, channels of transmission that is coming usually by protecting all those things, that you can do control the source and here also, right? But channels of transmission, to you are giving safe food, safe water, safe milk, safe drinking drinks, etc., etc. Channels of transmission, you can take some productive individuals, right? Channels of transmission, your good housekeeping, your personal hygiene remaining very good. You give blood safety measures, blood safety and all those things. You keep injection measures and etc., etc. Channels of transmission, right? So this is another action, control channels of transmission. Third action you can do protection, protecting the individual, protection. I can protect you, I can protect myself. How? That comes to the immunization. Immunoprophylaxis called, chemoprophylaxis by some chemical agents. Okay? So, all these things you can do. So, we can protect our individuals or human beings by mainly three actions. One action at the source or reservoir of infection, second action at the channels of transmission, and third action at the protecting you yourself so that you not suffer from disease. Again, say, of course, health promotion is there. I will ask you to for balanced food, good lifestyle, no smoking, exercise, etc., etc., and all those things, and immunization. Now coming to the immunization, right? So before coming to the immunization protein, I have already told you host factors. We should know. We have some host defenses there. People differ from here and there. All are not suffering because we have some host defense mechanism. It differs from man to man. A person is said to be immune. Often you call immune. Among boli na kotha kotha, hey, tor immunity khub high. Tu bhugchis na. That means a person is said to be immune when he possesses specific protective antibodies or cellular immunity as a result of previous infection immunization. Amra during our childhood, আমরা কিন্তু কোনো ভ্যাকসিনেশন পাইনি, তাই না? আমরা ইউজ কোনো, কিন্তু আমরা তো তারপরও কিছুটা ইমিউনিটি তৈরি করেছি। কেন? ইট ইজ কল্ড, আমরা ডিফারেন্ট টাইপস অফ সাফারিংস করেছি। ইফ ইউ সাম এজেন্ট ইজ এন্টারিং, ইনফেক্টিভ এজেন্টস এন্টারিং, it is called antigen. When this antigen enters in your body, against it antibody is produced. So suppose diphtheria, tetanus and all those things. Tetanus you are giving toxoid, there is antigen you are giving. Against it antibody is produced. So when further infection the body fights. তার মানে আমাদের বডিতে সৈন্য সামন্ত তৈরি হয়ে রয়েছে। When an enemy enters, they fight it. Okay, so maybe result of previous infection or immunization. আর যদি তোমরা তোমাদের previous infection হতে পারে আর তোমরা অনেকেই immunization পেয়েছো। So your body is protected, already immune to against those immunizing agents, by those immunizing agents. So it is called, there is an immunity. It is so conditioned by such previous experience to respond adequately infection clinical. So by specific agents, আমাদের বডিতে কিছু already host defense বা host mechanisms are already there, right? So coming to the immunity, immunity may be two types. One is called active immunity, that is immunity which an individual develops as a result of infection or by specific immunizing agents. So in your body, if immunity is already there due to some vaccination, it is active immunity, or by infection. Maybe suppose as it is called, আমাদের কারো কারো subclinical COVID infection হয়েছে, so already we are immune that particular type of COVID virus, already immune. এবার যদি new, because virus are always changing, as you know, it is called mutation is going on. If new mutant is there, I may have some protection, may not be 100% protection. So I am suffering again now, but due to all this. So active immunity develops as a result of infection or specific immunizing agents, and that may be three types. Humoral immunity, it develops from beta cells, bone marrow derived lymphocytes. Humoral immunity means through different plasma, sera and all those things, some beta cells are there. Through they maintain this immunity. It is called humoral immunity. Through your circulating system, your lymphocytic system, etc., etc. Beta lymphocytes and etc. All these things it prevents some immunity called humoral immunity. There is called cellular immunity. In the cell itself, some immunity is there. Cell is fighting. That cells is mediated by mainly called T cells. Thymus T cells. T cells immunity is often called in some of the immunizing agents we give, both T cells are activated, we are triggering them, or some beta cells also activated, the humoral immunity develops. And third may be combination of both. So, our active immunity may be produced due to the infection and or due to the particular immunization. And this active immunity remains in the body maybe in two ways or both by humoral immunity or by cellular immunity. Some of the agents, some of the fighting, both they are fighting, when sometimes they are both cellular immunity, humoral immunity protects us. Okay, and there may be some passive immunity. This is all these are required, knowledge is required for our treatment, etc. Passive immunity, when antibodies produced in one body are transferred to the other diseases. I have already told you, when infection is entering to your body or you are giving vaccines, that means I am introducing in your body, administering in your body antigen. Against that antigen in body, antibody is produced. That is active immunity. But sometimes the disease is so important or so serious, one may die. You can give passive immunization directly entering antibodies. And nowadays antibodies, some of the diseases against antibodies are produced. I am giving you examples. You know rabies, very fatal. Rabies is called, most of the diseases we entering in our body and it one may suffer, complication may be occur, one may die. Sometimes examiner asks you, you call me one disease when agent entering in your body but you can protect. So a dog bite, rabbit dog bite bites you. If you take that vaccine, already you are 100% safe. Particular schedule, dose schedule is there and rabies and all these things. So that rabies nowadays, previously when we were MBBS students, we call rabies vaccine we used to give. But nowadays along with rabies vaccine, if the degree of bite is much more in the wound area, we give immunizing agents, antibodies also injected. So both, because rabies is so serious, people die. Rabies and tetanus, people will die. So administration of antibody containing preparation, immunoglobulin or antiserum. Transfer of maternal antibody through placenta and through breast milk. Some protection, the baby or fetus is protected because in mother's body, some already immunizing agents are there, already antibodies are there, it enters through the placenta and all those things and body, protected, etc. Right? So immune response in active immunity, how it occurs? It is called 2 ways, primary response, elicited within 3 to 10 days by coming in contact with antigen for the first time. Antibody elicited first is entirely to the IgM type, later on IgG antibody. You will see now the IgM test and all those things are there. Initially IgM develops, then IgG etc. develop. Immunoglobulin G, immunoglobulin M, these are different types. So if you, it is again, you have to read further and further all these things. So it depends upon the dose of antigen, how active immunity develops. It depends upon the nature of the antigen. It depends upon the nutritional status of the host. It depends upon the adjuvants, etc. Adjuvants means in that immunizing agents which are already there. So some adjuvants are very good, some adjuvants may prevent also. So that drug development, drug research and all those things are very there. So immune response, active immunity usually maybe primary response, maybe secondary response. Primary response may depend on upon the dose of the antigen, upon the nature of the antigen, nutritional status of the host, etc., etc., and all these things. I mean, immunosuppressive treatment may be secondary or booster response. You have heard of booster dose? It is said when in the fetus DPT vaccine and all those things given to the baby in the during infancy, then first year of life, it causes primary response. Then at the age of 16 to 24 months or at the age of 4 to 5 years, we give another one dose, that is boosting up that immunity. Already তুমি 2 বছর 3 বছর আগে তোমার কেটে গেছিল, তুমি টিটেনাস টক্সাইড নিয়েছো ফার্স্ট টাইম বা তার আগে ফার্স্ট যেটা নিয়েছো, সাম প্রাইমারি রেসপন্স ইজ অলরেডি দেয়ার। তো যদি বলো স্যার প্রাইমারি রেসপন্স ইজ দেয়ার, তাহলে ডাক্তারবাবু কেটে গেলেই এই কেটে গেছে, রক্ত বেরিয়েছে, সয়েলড হয়েছে, এই একটা টিটেনাস নিয়ে নাও, কেন বলে? বলে অলরেডি সাম ইমিউন ইজ দেয়ার, বাট দ্যাট মে বি এট দ্য প্ল্যাটু লেভেল। সো ইউ আর booster dose, but tetanus is very serious disease, you may die. So for this reason, if you get tetanus toxoid, that primary response boost up, peak উঠে যায়, সেই না primary response দিতে বলে। So secondary response is IgM antibody through the collaboration of beta and T cells, it boost up, and you can give a response by shorter latent period, so latent period shorter হয়ে যায়, production of antibody more rapid, boosting up, antibody more abundant, become more and antibody হয়ে যায়, antibody response maintain higher levels for longer period of time, right? Antibody elicited have a greater capacity to bind that antigen. Okay, so immune response in active immunity is maybe primary response, maybe secondary response. So if we have those knowledge, I can take proper precaution in taking actions to those individuals, right? Actually, I discussed you all those things in what is immunization, etc., etc. This national immunization schedule I will not discuss in detail, because national immunization schedule which is going on immunization throughout our program, it is already in government of India's time to time, it also changes. When our time, usually 6 or 7 vaccines is there. Now during infancy, plenty of vaccines are there you are giving. So it is changes. You will give in the books, but you have to know 100% before going to the exams. Anybody may ask you at this particular age, what is the infection is there. Suppose pregnant woman immunization, you have to know this 100%. It is in the book or in the net you will get. But always remember, in the net, national immunization schedule followed by our government of India. You should not tell the immunization going on in America. Examiner will not know. National immunization schedule going on in our country, you will get in the books and etc. Latest one. You have to know the latest, etc. Only thing you will remember, suppose a mother is pregnant for the first time, priming. Have you heard of what priming? Primipara, priming? তোমাদের obstetrics gynae class হচ্ছে না? Primipara, first time pregnancy. So if priming is there, you have to give 2 doses vaccines. If within, booster is given, even the woman becomes second time pregnant or third time pregnant, within 3 years of previous pregnancy, 1 dose of tetanus toxoid is enough. Okay, so it is said that in our country, actually pregnancy 3 trimester is there, 3টে ভাগে ভাগ করা আছে, first trimester, second trimester, third trimester. It is said if it is early, if you give in the second trimester first dose, then after 4 to 6 weeks. Another thing I am giving you, remember, এটা আমাদের একটা ভুল আইডিয়া আছে, in the books you will always see that second dose 4 weeks or like that. That does not mean you will give only in 4 weeks. Whenever your patient or child or mother comes, you will give the second dose. সেটা 6 উইকস পরে হতে পারে, 3 মাস পরে হতে পারে, 6 মাস পরে হতে পারে। ইমিউনেশন ইউ হ্যাভ টু গিভ, রাইট? বাট আইডিয়ালি if it is said that usually in most of the vaccines first dose and second dose gap is 4 to 6 weeks, 1 থেকে 1.5 মাস। এটা মনে রাখবে। ও টিটানাস টক্সাইড দিলে এই যে এখানে লেখা আছে আফটার 4 উইকস, দ্যাট ডাজ নট মিন তুমি একটা মেডিকেল অফিসার গিভিং ইউর ট্রিটমেন্ট, তোমার একটা মাদার এলো 6 সপ্তাহ পরে বা 2 মাস পরে, হ্যাঁ তুমি 2 মাস পরে এসছো, যাও তোমাকে ভ্যাকসিন দেবো না। ইউ ক্যান নট টেল। ইফ হি গোজ টু দ্য কোর্ট ইউ উইল বি পানিশড, because your already primary response is there, you have to give his second dose. Ideally একটা মেনটেন না করলে, একটা মনে রাখবে হিউম্যান বিংস এর একটা টাইমলাইন দিতে হয়। আমি যদি তোমাকে টাইমলাইন না দিই, তোমাকে যদি বলি তোমাদের পরীক্ষা হবে ফেব্রুয়ারি মার্চ, কবে হবে ফার্মা, কবে হবে তোমাদের? মার্চে না ফেব্রুয়ারিতে? মার্চে। তো আমি যদি টাইমলাইন আগে থেকে না দিই তাহলে ইউ উইল নট প্রিপেয়ার ইউরসেলফ। এভরিথিং হ্যাজ গট সাম টাইমলাইন, সেজন্য একটা টাইমলাইন দিয়ে দিয়েছে। আমাদের ইমিউনেশন কার্ড থাকে, ইমিউনেশন কার্ডে লেখা থাকে 4 সপ্তাহ হবে, এবং সিস্টাররা ডেট দিয়ে দেয়। কারণ আমরা আমাদের হিউম্যান বিংস তো মনে রাখতে পারে না ওই তারিখে আসবে, কিন্তু ওই তারিখে তো তার অসুবিধা থাকতে পারে, সে অসুস্থ থাকতে পারে, সে আসেনি, তুমি যখনই আসবে দিয়ে দেবে, রাইট? এখন বলে টিটানাস টক্সাইড ইজ রিপ্লেসড বাই ডিপথেরিয়া, টিটানাসও হয়েছে, টিটানাস টক্সাইড, এগুলো মানে আস্তে আস্তে চেঞ্জ হচ্ছে। আর ফর ইনফ্যান্টস ইউ সি প্লেন্টি, সো আই উইল নট ডিসকাস অন অল দিস থিংস। এখন তো পেন্টাভ্যালেন্ট ভ্যাকসিন, এই যে পেন্টাভ্যালেন্ট, পেন্টা মিন্স, পেন্টা মানে কি? 5টা ভ্যাকসিন দেওয়া হয়। আমাদের সময় 3টেতে ডিপিটি বলা হতো, অলরেডি ঢুকে গেছে। সো দিজ আর চেঞ্জিং, ওকে? ভ্যাকসিনেশন, অলওয়েজ রিমেম্বার, ভ্যাকসিনেশন বললেই যে তুমি পোলিও, বিসিজি, ডিপথেরিয়া, টিটানাস, হেপাটাইটিস বি এসব যেসব বলবে তা নয়। ভ্যাকসিনেশন কিন্তু ভিটামিন এ নয়েলটাকেও কিন্তু বলতে হবে তোমাকে। এই যে ভিটামিন এ, ভিটামিন এ আমাদের এখানে হচ্ছে না আইডিয়ালি, এখানে হেলথ সেন্টারে তোমরা দেখতে পারবে, পরে দেখতে পারবে, তোমাদেরকে ইমিউনেশন ক্লিনিকে নেওয়া উচিত। আইডিয়ালি হচ্ছে যে এখনো গভর্নমেন্ট মেডিকেল কলেজে ডিপার্টমেন্ট অফ কমিউনিটি মেডিসিন ইমিউনেশনটা দেয়, সেজন্য ক্লাসের সময় আমরা নিয়ে যাই, দেখে যাই। ভিটামিন এ অয়েল আসে গভর্নমেন্ট অফ ইন্ডিয়া, 1 চামচ করে খাওয়ানো হয়, তাতে 2000 ইন্টারন্যাশনাল ইউনিটস আছে। ভিটামিন এ ইজ ভেরি ভেরি ইম্পর্টেন্ট। ভিটামিন এ তাহলে আমাদের অনেক আগে আমাদের নাইট ব্লাইন্ডনেস হতো, ভিশন কম হতো। এখন আমরা ভিটামিন এ খেলে, ভিটামিন এ ডি কি টাইপ অফ ভ্যাকসিন? ফ্যাট সলিউবল ভিটামিন, মানে এটা থাকে বডিতে, স্টোর থাকে। এটা এক্সেস হলেও ক্ষতি, আবার কম হলেও ক্ষতি। এই এডিইকে এর মধ্যে এখন একটা ভ্যাকসিন নিয়ে একটা ভিটামিন খুব আমাদের শিক্ষিত সমাজে খুব আই মিন ডেফিসিয়েন্ট হচ্ছে। কোনটা? এটা অতটা নয়, বলো। ডি সানলাইট, ডি এর ফুড সোর্স খুব কম, ইউজুয়ালি ভেজিটেবল সোর্স আছে খুবই সামান্য, বাদ নেই। একটু ফিশ অয়েল, কড লিভার অয়েলস, একটু এগে একটু আছে, মিট টিটে একটু খুব সামান্য আছে, কিন্তু মেইনলি। কিন্তু আমরা কি করছি, স্পেশালি আমাদের লেডিজ, আওয়ার গার্লস, আমরা অলওয়েজ ছাতা ইউজ করছি, অলওয়েজ সানস্ক্রিন লাগছি। এই যে ভিটামিন ডি ডেফিসিয়েন্ট খুব কমন হচ্ছে, এবং অনেকেই কিন্তু সাফার করছে ভিটামিন ডিতে। সেই জন্য এখন কেউ ভিটামিন ডি ক্যাপসুলস আছে, 60,000 ইউনিট, মাসে একটা করে খায়। কিন্তু মুশকিলটা হচ্ছে এগুলো যদি প্রপার ইভ্যালুয়েট করে তুমি যদি ভিটামিন ডি ইন ইউর ব্লাড না দেখে খাও, দিস আর ফ্যাট সলিউবল ভিটামিন, এটা স্টোর থাকে, টক্সিসিটি হতে পারে। ভিটামিন বি কমপ্লেক্স, সি, দিস আর ওয়াটার সলিউবল, ইট কামস আউট ফ্রম ইউর বডি, রাইট? সো ভ্যাকসিনেশন, এটা বলার অর্থটা হচ্ছে, হোয়েন ভ্যাকসিনেশন তুমি এসবগুলো বলবে, মিজলস, টিজলস, আইএমআর, ম্যান বলবে, জাপানিজ এনকেফালাইটিস এগুলো বলবে, তুমি ভিটামিন এটাও বলবে। ভিটামিন ইজ এ ভ্যাকসিনেশন। ভ্যাকসিনেশন ডাজ নট মিনস ইনজেক্টেবল বাট ওরালি এগুলো দেওয়া হয়, ওষুধ নয়। ভিটামিন এ দো বাট ইট ইজ এ ভ্যাকসিনেশন, বিকজ it protects the babies from vision and other skin related diseases. আর ভিটামিন এ আর কিসে পাওয়া যায় খুব? এগুলোই হচ্ছে খুব কমনলি কোথায় পাওয়া যায়, যেটা আমরা শিক্ষিত সমাজ ইউজুয়ালি খাই না। ইয়েস, গ্রিন লিফি ভেজিটেবলস প্লেন্টি ইজ দেয়ার, আমরা খাই না। আমাদের দেশ থেকে কলমি শাক এগুলো যায়, মানে লন্ডনে বা আমেরিকাতে, নিউ ইয়র্কে বিক্রি হয়, লোকে বেশি দামে খায়। ওরা অনেক আমাদের থেকে শিক্ষিত। আমি নিজেকে আমরা শিক্ষিত বলি না। উই আর কোয়ালিফাইড, উই আর নট এডুকেটেড। তোমার কোয়ালিফিকেশন আছে, বড় বড় ডিগ্রি আছে, কিন্তু তুমি কিন্তু এডুকেটেড নও। আমি তোমাদের বলছি না, বিকজ আমরা কম জানি, আমাদের থিঙ্কিং খুব কম। আমরা ওই আমাদের সবই সিস্টেমটা গেছে, আই মিন ইউনিভার্সিটি সিস্টেম এসেট্রা, আমরা শুধু পাস করছি। আমি ওই জন্য ক্লাসে বলি পাস করা কোনো ব্যাপার নয়। আই ইউজ টু সে, আমাদের দেশে বিশেষ করে ওয়েস্ট বেঙ্গলে, মানে স্পেশালি ইন ক্লাস 10-এ বোর্ডে এক্সামিনেশনে কি করে মানুষ ফেল করে। ক্লাস 10 সিলেবাস ইজ সো ইজি, 11-12-এ কিছুটা কঠিন এসছে, কেন ফেল করছে মানুষ, স্টুডেন্টরা ফেল করছে, তার মানে কিছুই যায় না। 11-12-ও তাই হয়েছে, রাইট? So all these things are there. So plenty of in this country, in this society, everything is there. But due to our ignorance, you are less educated, we are suffering. Okay? আমাদের যা আছে, we can protect ourselves in a good way. কিন্তু আমরা ওদের কিছু কিছু নিচ্ছি, আমরা জানি না। ওদের দেশের কোনো কোনো কান্ট্রি, কোনো কোনো এরিয়াতে ম্যাকডোনাল্ডস ব্যান্ড, আমরা ম্যাকডোনাল্ডস গিয়ে খাচ্ছি। So this is the problem in our country. McDonald's and all these things. এবং ওদের দেশে, I mean, the food safety adulteration is so much good. আমরা প্যাকেটে কিন্তু লিখছে, কিন্তু প্যাকেটে কিন্তু ভুলভাল আছে। আমরা প্যাকেট কে দেখবে? Who will do the test? আমাদের সেই পাবলিক ল্যাবরেটরি নেই। All those things are there. Okay? ওটা ইনফ্যান্টস বললাম, আগেরটা ইনফ্যান্টস, এটা ইনফ্যান্টস এতগুলো। ইনফ্যান্টস মিনস উইদিন 1 year এতগুলো ভ্যাকসিন যাচ্ছে শরীরে, বেবি 1 year। তারপরে ডিউরিং চিলড্রেন এতগুলো ভ্যাকসিন যাচ্ছে ফর চিলড্রেন। ওই বুস্টার, আই অলরেডি ডিপিটি বুস্টার, মিজলস অ্যান্ড মাম্প রুবেলা বুস্টার, ওপিভি বুস্টার এটসেট্রা। মাম্পস রুবেলা কাদের দেওয়া হয়? গার্ল চিলড্রেন। ইউজুয়ালি ছেলেদের দিই না আমরা, যে J2 ভিটামিন এ বুস্টার ডোজ, ডিপিটি বুস্টার ডোজ, এটসেট্রা, টিটি, এটসেট্রা এটসেট্রা। ওকে, এবার এই যে পার্টিকুলার ভ্যাকসিনগুলোর সম্বন্ধে আমরা আলোচনা করব। ওকে, সো টুডে উই ডিসকাসড দিস ইমিউনাইজেশন, I mean how immunity develops, how we can protect our body from these channels of transmissions through, and protecting ourselves by specific protection through immunization. And I am telling you again, ইমিউনাইজেশন শুধু পরীক্ষায় নয়, চাকরি বাকরিতে যখন যাবে, তোমাদের নাম বলবো না, এই ডিউরিং প্রেজেন্ট ব্যাচ, এই যে এই নিউ ফার্স্ট ইয়ার এসছে, তাদের একদিন দেখি আমার ঘরে একজন ভদ্রলোক ঢুকেছে, স্যার আমাকে চিনতে পারছেন?
RNA virus and DNA virus example, use mnemonic, এর একটা কোড আছে, এক্সামিনেশন হলে যেন ডিকোড হয়, এরকম ভাবে বানাবে। না থাকলে আমরা আমাদের শর্ট ডিসকাশন ক্লাসে বলে দেবো হাউ টু রিমেম্বার RNA ভাইরাস অ্যান্ড DNA ভাইরাস। What is positive sense and what is negative sense? Positive sense and negative sense. Hello? Positive sense and negative sense virus. Mixing of virus. When a particular or specific cell is mixed with same type of virus, what will be the consequences? What is called marker rescue. So this is a very important question, mixing of virus. cell culture, cultivation of virus, cell culture. What is embryonated egg? What is embryonated egg? যার মধ্যে এমব্রায়ো আছে 9 to 12 days, 9 থেকে 12 দিন ইনকিউবেটরে রাখতে হবে একটা ডিমকে, তখন সেটা এমব্রায়োনেটেড হবে। সেই ডিমের মধ্যে ভাইরাল সেল কালচার হয়, এমব্রায়োনেটেড সেল কালচার। ছবি আঁকবে উইথ পিকচার। ভেরি ইম্পর্টেন্ট কোশ্চেন। হোয়াট ইজ সেল ভাইরাল কালচার? কোশ্চেনগুলো লিখে নেবে, ওয়ান বাই ওয়ান আমরা আমাদের শর্ট ডিসকাশন ক্লাসে ডিসকাস করব যদি কোনোটা অসুবিধা হয়। অ্যান্টিভাইরাল ড্রাগস, herpes simplex virus 1 and herpes simplex virus 2. Short note. Epstein-Barr virus, Epstein-Barr virus, a carcinoma producing virus. Type of carcinoma it produces, how, the mechanism, and as well as a heterophile antigen is associated with this viral spread. A very important question, herpes, Epstein-Barr virus. Influenza virus, so many pandemic is associated with this influenza virus. Hemagglutinin, neuraminidase, as well as the seroarchaeology of the particular virus, influenza virus. Please note the particular terminology, seroarchaeology of influenza virus. The viral mutation of influenza virus. Arboviral disease. By definition, what is arbovirus? What is arbovirus by definition? And read only three viruses: dengue, number two, chikungunya, and number three is Japanese encephalitis virus, including their vector and the transmission cycle. Their vaccine also. Rhabdovirus, জলাতঙ্ক রোগের কারণ rhabdovirus. The structure of rhabdovirus and different type of vaccine. কুকুরে কামড়ালে তোমাদের চেম্বারে পেশেন্ট আসবে, সেই ভ্যাকসিনটা যদি নিতে না পারো তাহলে হবে না। So rhabdovirus, rhabdoviral diseases as well as their vaccine. Poliovirus, pulse polio, short note. Diarrheogenic virus. Diarrheogenic virus, short note. Viral hemorrhagic fever, viral hemorrhagic fever, viral hemorrhagic fever, short note. Human papilloma virus, human papilloma virus and vaccine. These only 20 questions. HIV, complete, full HIV, including their genome and, sorry, one more question is there. Question 21. Hepatitis B virus, antigen, HBsAg, etc. and HCV. These 22 questions. So this is all about virology. HIV is very much important, including its genome, all the antigen by which we test in our lab, the HIV virus detection tests. What is window period? How to detect HIV within the window period, and HIV associated diseases. HIV associated diseases. And retrovirus, the mechanism of action, how retrovirus produce carcinoma. Hepatitis B virus, including its genome cycle, in genome and cycle, and different antigen to identify HBsAg in our lab. And the next is HCV virus, another blood transfusible virus. And the procedure of identification of HCV is a carcinogenic virus. HCV. HIV is oral fecal contamination, and the resultant is HIV. So these are 22 questions only. Read it and we will discuss it during our short class discussion session. So let us start on today's topic. So the national program which are related for our purpose, the microbiological purpose, as well as for your practicing purpose, only to remember these few infectious disease. The first question is objectives of learning. To know the ongoing programs. To learn the ongoing programs is important because you can remember easily that during the COVID period, the COVID vaccination protocol was very much important. And being a doctor, often you will be asked by your patient that how to take this vaccine, what are the protocols of taking COVID vaccine. Then at that time, it was very much essential for a clinician to discuss these things with your patient, and as well as for the community, it is very, very much important. So the ongoing programs is important to know the relevance. Why? And why this particular program is important for India or West Bengal scenario. To know which are vertical and which are horizontal program. What is vertical program? Vertical program means the program limited to a particular disease. The program limited to a particular disease, targeting a particular disease, and then covering a particular region too. So a particular disease covering a particular region is known as vertical program, as well as horizontal program when the whole world is following that particular protocol. In case of oral polio vaccination campaign, at that time, the whole world almost is following, the whole India is following that same program. So this is the horizontal program. And the vertical program is periodic, horizontal program is continuous. Diseases for which a program needs to be executed. When we implement a program at the national level or the regional level, what is the importance of that? The importance is that when the particular disease is of high morbidity and significant mortality. Morbidity means when the patient is suffering from a particular disease, and mortality means high death rate. High death rate. So morbidity and mortality spread over a large area crossing the state border. West Bengal, Bihar, Odisha. All three zones are affected. The eastern region of India is affected. The part of an international program, it may be the part of an international program like COVID vaccination program, etc. So program started long ago in 1951 was BCG. The BCG. What type of vaccine is BCG? Live vaccine or killed vaccine? So this is BCG. 1952, the Community Development Program. 1952, the National Malaria Control Program. 1954, the National Water Supply and Sanitation Program. 1954, the National Leprosy Control Program. The National Filaria Control Program. And 1958, NMLC, National Malaria Eradication Program. One by one, so many programs are there. Not to remember anything, the first one, remember only this first one, 1951 is BCG. And the National Malaria Eradication Program, 1958. The factors for selection of an infection for control program. What are the factors? What are the factors for selection of an infection for control program? Why you take the program? Importance of taking one program. What are the reasons behind it? Area with high incidence. On a particular area, say for example, cholera. Cholera in a particular locality. Explore the targeted population who are at high risk. Say for example, pneumonia. Pneumonia targeting the senior citizens. The assessment of the risk factor. What are the risk factors? The patients are taking corticosteroids. Patients are taking corticosteroid inhaler. Nephrectomy patients are there in a particular hospitals, a cancer caring hospital. So these are particular types of risk. The assessment of transmission cycle. The transmission cycle is very important. In case of parasites, soil is it plays an important role. If there is no soil factor, the transmission of many parasites are hampered. So the transmission cycle, to learn the transmission cycle and to cut between these two, can control spread of a particular disease. The assessment of suitable point to cut the transmission and the availability of vaccine. During the COVID period, there was no vaccine initially. So we are always searching that how to prepare a vaccine. And it was really a challenge at that time to prepare a COVID vaccine. To prepare an influenza vaccine, it takes almost 1.5 years. But at that time, it was a mere emergency to produce a COVID vaccine to save our people, because mortality, morbidity rate was very high. The age factor was important. It was affecting the senior citizen. So all those factors were there during the COVID period. And to prepare a vaccine, initiation of vaccine, to prepare, to follow a particular program is important at the national level, and not only the national level, at the international level. The key areas of preparedness: the logistic in place, the personal training, how to give the vaccination, how to send the materials, to follow the particular cold chain. The people are brought to confidence. Na vaccine nevo na, COVID vaccine nile more jabo. That was regarding the COVID vaccine. So to convince them, so no, nothing will happen. Please take this vaccine. This is emergency. The separate health administrative structure. A particular health administrative structure is required. From the central level, there was ICMR. From ICMR to the district, to the regional level, then to district level, then to subsidiary level. So this was the chain which were followed. The system for data collections, compilation, the ICMR data at that time, remember the data. At that time, they were collecting all the data from the different regional center. What type of vaccine is given? What is the dose? Who are taking the vaccine? What are the results? If you miss the second dose, there is an alert. So these are the system of data collection, compilation, analysis, and the feedback. Subsequently, the trial run. The trial run is definitely not our part, but trial run at the level 1, level 2, level 3, these are the trial run. You will read this in pharmacology chapters. So ongoing national programs on infectious disease is NVD-DCP, the filaria, malaria, kalajar, JE, dengue and chikungunya. So this is the National Vector-Borne Disease Control Program, NVD-DCP. The RNTCP is Revised National Tuberculosis Control Program. The National Leprosy Eradication Program, Universal Immunization Program and National Guinea Worm Eradication Program. Most important is National Vector-Borne Disease Control Program and RNTCP or Revised National Tuberculosis Control Program for you. These two you have to remember. Other than these, there are ROS Control Program, National Filaria Control Program, Integrated Disease Surveillance Program and National AIDS Control Program is also important for you. So only to remember these three programs. NVDCP launched in 2003-2004. Purpose: the disease targeted malaria, kalajar, lymphatic filaria, JE, dengue and chikungunya. What is the causative agents of kalajar? Causative agents of kalajar? Leishmania? Leishmania don't have an eye. What is the name of this vector responsible for the disease? Sandfly. What is the full name of sandfly? Phlebotomus argentipes. Malaria. Causative agents of malaria? What is the name of the species? Malaria? Plasmodium. Plasmodium? What? Vivax. Plasmodium? Falciparum. Plasmodium? Malari. Plasmodium? Oval. And? Yes, or Plasmodium knowlesi, the fifth one. So these are the 5 causative agents of the malaria. The lymphatic filaria, causative agents of filariasis? Wucheria bancrofti. Other than these, can you name any other filaria? Brugia malloy, Onchocerca volvulus, Loa loa. Anyway, JE, Japanese encephalitis, causative agent? No. Japanese encephalitis? Vector? Is it mosquito borne? ওরে মশা কামড়ালে হয় কি হয় না? হয় না হয় না? হয়। সে মশার নাম কি? কিউলেক্স বিষ্ণুই। কোথায় থাকে? প্যাডি ফিল্ডে থাকে, চাষের জমিতে থাকে। And another one is Culex trichinier hincus. Culex trichinier hincus. What is amplifier host? What is amplifier host? যার মধ্যে অ্যাম্পলিফিকেশন হয়, মাল্টিপ্লিকেশন হয়, কিন্তু সে নিজে এফেক্টেড হয় না। Pig. Pig is the amplifier host. So during this program, Japanese encephalitis program, we shift the piggery at least. এইসব স্লটার হাউসগুলোকে আমরা সরিয়ে দেই, শুয়োর থাকলে চলবে না, ওগুলোকে আমরা অ্যাটলিস্ট কত কিলোমিটার দূরে সরাই? only 1.5 কিলোমিটার, 1.5 থেকে 2 কিলোমিটার দূরে পাঠিয়ে দেই। কেন? ওয়াই 1.5 কিলোমিটার? কিউলেক্স বিষ্ণুই 1.5 কিলোমিটার রেঞ্জের মধ্যেই ঘোরে, এর বাইরে যায় না। ওরে বোকা বলেই আমি তো পরীক্ষার হলে, এগুলো ধরে ধরে পড়তে হবে, নইলে বোকার মতো তাকিয়ে থাকবি এক্সামিনেশন হলে। সব ডিসকাস করব, মনে রাখবি সব ট্রিকি কোশ্চেন্স আছে, এগুলো সব ডিসকাস করব শর্ট ডিসকাশন ফেজে। ডেঙ্গু এন্ড চিকেনগুনিয়া, হাউ টু আইডেন্টিফাই ডেঙ্গু? ডেঙ্গু কোথা থেকে হয়? মশা না মাছি? কি মশা? এডিস মশা। হে বাবা, প্রতিদিন তো কাগজে উঠছে ডেঙ্গু। হাউ টু আইডেন্টিফাই? কি করে আইডেন্টিফাই করবে? সেরোলজিক্যাল টেস্ট গুলো কি কি? NS1 and dengue IgM and IgG. IgM and IgG. IgM and IgG. To identify the secondary dengue, which may produce dengue shock or dengue hemorrhagic fever. For that purpose, IgG is important because secondary dengue is dangerous, no? আরে বোঝা যাচ্ছে কি জায়গায় আছো? ঠিক আছে, চলো। Objectives: to reduce the incidence of malaria, dengue, chikungunya and JE by 50% by 2017. আমরা অলরেডি ফেল করেছি। 2017 এর মধ্যে 50% রিডাকশন দরকার ছিল, হয়নি, প্রচুর হচ্ছে। To eliminate Kala-Azar and lymphatic filariasis by 2015, অনেকটা হয়েছে। Strategy: the vector control program except JE. ভেক্টর কন্ট্রোল প্রোগ্রাম JE তে ইনক্লুড করা হয়নি। কেন? 1 নম্বর এটা ভাইরাল ডিজিজ, 2 নম্বর প্যাডি ফিল্ডে থাকে, ওখানে স্প্রে করলে ধান খাবো, চাল পাবো না, তাই হয়নি। ইনসেকটিসাইড স্প্রে করা যাবে না ওখানে। বায়োলজিক্যাল কন্ট্রোল, গাফকি মশা, সোর্স রিডাকশন। ওই যে রেগুলার বলছে বাড়িতে জমা জল রাখবেন না, জমা জল রাখা চলবে না। সাপোর্টিভ ইন্টারভেনশন, সাপোর্ট করতে হবে। কমিউনিটি যদি এগিয়ে না আসে, কোনোদিন ইরাডিকেশন প্রোগ্রাম সাকসেসফুল হয় না। টু মেক ইট এ সাকসেস, দ্য কোঅপারেশন ফ্রম অল লেভেল ইজ রিকোয়ার্ড। Case finding and treatment except JE. It is very difficult to find the case source in JE. During a survey, I can remember in Medinipur district, almost about 1600 people were seropositive, and in one case was found to be that he was suffering from JE. So one positive case and 1600 seropositive case. Only one case was suffering from encephalitis, Japanese encephalitis, but the antigen was positive among 1600 patients. So vaccination in case of JE is very important. The emphasis on personal protection, surveillance, outbreak investigations, measures to control, progress evaluation and necessary revision of the program is required. This is all governmental level. The RNTCP, what is the full form of RNTCP? Revised National Tuberculosis Control Program, RNTCP. NTP, the National Tuberculosis Program. In the year 1962, the NTP, the first NTP, it was targeted only to identify the case and to treat the case first. This was the main goal of that program, NTP. Next, the National Tuberculosis Program was reviewed in 1992, but failed to deliver expected results. So, another program is DOT. What is DOT? Directly observed treatment. Patient ke deke, this is the target is the patient. It is patient-oriented program. Each and every patient is asked for taking this drug. প্রত্যেকটা পেশেন্ট আসবে, তাকে একটা করে ড্রাগ দেব ফর দ্যাট ডে। সেই দিনের জন্য সেই ড্রাগটা পাবে। নেক্সট ডে হি অর শি উইল কাম and will get the next dose. This is just to avoid the drug resistancy and drug defaulter. কেন হাসছো কেন? সো এটাকে অ্যাভয়েড করার জন্য ডট প্রোগ্রাম হলো, ডাইরেক্টলি অবজার্ভ ট্রিটমেন্ট শুরু হলো। ডট 1997 RNTCP, the entire country under RNTCP. What is RNTCP? Revised National Tuberculosis Program. আগের প্রোগ্রামগুলো ফেল করেছিল। That's why there was the revision of the earlier program. What was the target? The target was sputum positivity. To target was sputum positivity. That means positive case is the source. So to eradicate the positive cases, sputum examination was mandatory. Any chest pain, any cough, persisting cough, hemoptysis, and evening rise of temperature. During examination, I was asked, what are the features of a patient of tuberculosis? There was no answer. Evening rise of temperature, chronic cough, persistent cough for more than 1 month. This is classical. Hemoptysis, coughing out of blood. So RNTCP, the target is sputum positivity and to treat the patient on the basis of the main drug, rifampicin, INH, and if required, pyrazinamide. So first line is rifampicin, first target is rifampicin, base is rifampicin. The last program of tuberculosis is NTEP, that is National Tuberculosis Eradication Program. National Tuberculosis Eradication Program, which is going on. It is not RNTCP, it is NTEP, National Tuberculosis Eradication Program. There is a particular guideline. The how much sputum field we have to examine, how to give the report, the scoring system, the treatment protocol, the short-term therapy of tuberculosis, the long-term therapy, what are the newer drugs to give. These are included within this NTEP program, NTEP 2020 program. Case finding, RNTCP based on case finding and diagnosis, the patient-friendly treatment, scale up to management of MDR tuberculosis. What is MDR tuberculosis? That I know, everybody knows that. MDR means multi-drug resistance. What do you mean by multi-drug? What are they? Multi-drug? Hey, bolo, multi-drug. কি tuberculosis and drug, multi-drug resistance মানে কি? বুঝতে পারছি না, হ্যাঁ? এগুলো রেজিস্ট্যান্ট হবে, মানে ফার্স্ট লাইন অফ ড্রাগ রেজিস্ট্যান্ট হয়েছে, তাই তো? মাল্টি ড্রাগ রেজিস্ট্যান্সি। Scale up to TB, HIV collaborative activity. The recent guideline is, if there is a case of tuberculosis, go for HIV identification, go for HIV test. In case of a positive tuberculosis case, go for HIV identification. And in case of HIV positive case, go for tuberculosis identification. So, TB and HIV is going hand with hand. That's why to identify TB, HIV is mandatory, and HIV for tuberculosis. Achievement of RNTCP, that covers whole country since 2006 March. The treatment success rate is 25% in 1990 to 88% in 2010. Death rate reduced from 29% to 4%. This is the achievement of RNTCP. The death rate reduced from 29% to 4% only. More than 15 million patients received treatment and saved 2.5 million lives. The National Framework of Malaria Elimination in India 2016 to 2030. So, it is still going on. It is active. Vision is elimination of malaria nationally. Goal, the zero indigenous cases. What is indigenous cases? Indigenous cases? The cases occurring at the local level. এখানেই হচ্ছে এন্ডেমিসিটি আছে এন্ডেমিক এখানে হচ্ছে ইন্ডিজিনাস কেসেস দ্য মেইনটেইন ম্যালেরিয়া ফ্রি স্ট্যাটাস মানে এখানে ওভেল খুঁজে কাজ নেই আমাদের objectives they eliminate malaria from 6 low category 6 low category 1 and moderate category 2 transmission states and UT, the Union Territories by 2022. Lower incidence to 1 by 1,000 population per year in all states and Union Territory by 2024. This is the targets. Interrupt the indigenous transmission by 2017 and prevention of re-establishment of local transmission by 30 and beyond. This is the classification of states of Union Territory based on API. The category is category 0, where the prevention of re-establishment and 0 is the score. Category 1, API will be less than 1 per 1,000 per year, elimination phase. And next, the category 2 is the pre-elimination, where API is less than 1 and reporting, but in the some district, they are reporting 1, more than 1. And category 3, intensified control phase, state of UTI with API more than 1. So, our target is API. The annual prevalence rate indices is less than 1 per 1,000 per year. What is incidence rate and what is prevalence rate? Job, Baba. What is incidence rate and what is prevalence rate? এতগুলো PSM এর কাজ করে আজকে রামনারায়ণ স্যারকে বলি, স্যার যা দুঃখ পাবে। হ্যাঁ, ইনসিডেন্স রেট the number of new cases in a target population. মনে করো আমাদের এই হাসপাতালে কটা নিউ কেস হয়েছে ম্যালেরিয়া, this is the incidence rate. And what is prevalence rate? New case plus old case by the target population divided by target population. মানে টোটাল কেস, যা নতুন হয়েছে যা পুরনো হয়েছে সব যোগ করে তাকে টোটাল পপুলেশন দিয়ে ভাগ, সেটা হচ্ছে প্রিভ্যালেন্স রেট। মনে থাকবে, হোয়াট ইজ নিউ কেস? ইনসিডেন্স রেট হচ্ছে নিউ কেস, আর প্রিভ্যালেন্স রেট হচ্ছে নিউ প্লাস ওল্ড। এইটুকু অন্তত মনে রেখো, বোঝা গেল? পিএসএম এর লোকেরা খুব দুঃখ পাবে রে এটা না জানলি তোরা। Key intervention: increasing scaling up of existing disease preventive approach, screening of all fever cases for malaria. যে কোনো জ্বর তোমার চেম্বারে যদি আসে, ফার্স্ট গো ফর ম্যালেরিয়া টেস্ট। প্রথম দিনই লিখো না, তাহলে আবার পেশেন্টরা খেপে যাবে, ডাক্তারবাবুর কাছে গেলেই টেস্ট লিখে দেয়, অশুভ আতাত আছে। সো ইফ দ্য ফিভার ইজ ভেরি মাচ, কি টাইপের ফিভার হবে? What type of fever? Where you can suspect malaria. Great. Hey, what? Yes, step ladder typhoid. ওসব বললে তো হবে না, ঢপ দিলি আর হবে না। বল বলো। যা, আমার দিকে কেউ তাকাচ্ছেই না। বিনাইন টার্সিয়ান মানে কি? এভরি থার্ড ডেতে হবে ফিভার। প্রথম দিন জ্বর এলো, পরের দিন জ্বর নেই, তারপরের দিন থার্ড ডেতে আবার জ্বর এলো। টার্সিয়ান, এভরি থার্ড ডে পেশেন্টের জ্বর আসছে। এটা তো বলতে হবে ভাই, ম্যালেরিয়া এটা না দেখলে তুমি ক্লিনিক্যালি পেশেন্টকে কি দেখবে? তারে ক্লিনিক্যাল আইডেন্টিফিকেশনই তো হলো না। তোমরা বুঝবে, timely referral and robust supply of chain management and equip the malaria detection and treatment center, capacity building and research. The Kalajar elimination 2002, Government of India set the goal of elimination in 2010, then revised it in 2015. ভালো কাজ হয়েছে। Visceral leishmaniasis, special searches for cases and treatment to find out PKDL cases. What is PKDL? What is PKDL? নামই শোনোনি। Post Kalajar dermal leishmaniasis. The Kalajar, if you start treatment, the Kalajar from viscerotropism to dermatropism, it transforms from viscerotropism to dermatropism. মানে ভিসেরা থেকে ডার্মালে আসে কালাজার, if you start your treatment. So patient যদি তোমার কাছে আসে with skin lesions, তাকেও কালাজার সন্দেহ করার যথেষ্ট কারণ থাকে। This is called PKDL. ASHA workers are to be trained and to involve the private sector, where 20% of cases seek treatment. The JE 2006 vaccination campaign launched in 11 sensitive districts of Assam, Karnataka, and UP. 2008 and 9, 86 more districts of 11 states, Assam, AP, Bihar. Har means Haryana, Goa, Kar means Karnataka, Kerala, and Maha is Maharashtra. Har, Kar, Maha is the terminology we use. 2022, the surveillance reports in lowering trend in incidents and case fatality rate. So successful JE program. What are the vaccine for JE? Still we practice this thing. Vaccines of JE. বলো কি কি ভ্যাকসিন আছে জাপানিজ এনকেফেলাইটিসে? এ তো লেখাই রয়েছে, আনসার। লাইভ অ্যাটেনুয়েটেড SA 14-14-2. This particular strain is South Asian strain. 14-14-2 is the genomic code. 14-14-2 virus strain নাম 14-14-2. And Genvac, the varocell derived, it is a kolar strain, Indian origin, 821/564XY strain. This is Genvac. We use in India Genvac in hyperendemic areas, included in universal immunization program. National AIDS Control Program, NACP 1, NACP 2. National AIDS Control Program continued NACP 3 to halt and reverse the epidemic by 5 years, scaling up focus on high-risk group. What is high-risk group of AIDS? High-risk group of AIDS. High-risk group of AIDS. Immunocompromised. High-risk group. ভালোগুলোও জানিস না, খারাপগুলোও জানিস না, কি যে তোরা করিস। আনপ্রোটেক্টেড সেক্স, সব জায়গায় কন্ডোম রাখা ছিল, কিন্তু আমাদের পপুলেশনে দেখা যাচ্ছে 5 to 10% ইউজ হয় না। So they are like unprotected sex. Sequela is possibility of HIV is increasing day by day. HIV unnoticed, undiagnosed থেকে যাচ্ছে among the population. Rather heterosex, homosexual behavior, এগুলো ইম্পর্টেন্ট। ব্লাড ট্রান্সফিউশন, নিডল শেয়ারিং এখন কমে গেছে ইস্টার রিজিয়নে। আমাদের দেশে হাইয়েস্ট সেলিং HIV কিট কোথায় জানো? সবচেয়ে বেশি HIV কিট কোথায় বিক্রি হয় জানো? ইস্টার্ন রিজিয়ন অফ ইন্ডিয়া। তাহলে কত পার্সেন্ট হিডেন কেস পেশেন্ট লিভিং উইথ HIV আন্দাজ করতে পারছো? Setting up of 15,000 reporting units and SACS and DAP CUS is required. এটা হচ্ছে গভর্নমেন্টাল কন্ট্রোল অ্যান্ড রিজিওনাল কন্ট্রোল লেভেলে স্ট্রেংথেনিং করার চেষ্টা হচ্ছে গভর্নমেন্ট লেভেলে। ওইটা আরেকটা আছে, হ্যাঁ নেক্সট, ঠিক, দ্য পালস পোলিও। 2 মিনিট কথা বলবো পালস পোলিও নিয়ে। ইট ওয়াজ এস্টাবলিশড ইন 1995 and 96. পালস পোলিও immunization campaign 95-96. Why the terminology is pulse? What is pulse? পালস পোলিও প্রোগ্রামের পালস মানে কি? ডাল। What is pulse? এভরিডে নিউজ পেপারে ওঠে। তাহলে নেটে কি দেখো? পালস কি? কেউ আর তাকাচ্ছে না আমার দিকে, সবাই ব্যস্ত নিচে। পালস এনি ট্রিটমেন্ট প্রোটোকল দুটো মোডে হয়। একটা হচ্ছে কন্টিনিউয়াস মোড, রোজ ওষুধ খায়, যেমন ফিজিওথেরাপিস্টরা আল্ট্রাসাউন্ড দেয় রোজ, কন্টিনিউয়াস মোডে। আরেকটা মোড কি? পালস মোড, দ্যাট ইজ ইন্টারমিটেন্ট মোড। ইন্টারমিটেন্ট মোড কঠিন অবস্থা। Oral polio vaccine is our target. picoRNA ভাইরাস। করকমের ওরাল পোলিও, করকমের পোলিও ভাইরাস হয়? একটা, দুটো, তিনটে, চারটে? ভ্যাকসিনের মধ্যে কি কি আছে? What is wild polio? What is vaccine polio?